PCT presents Public Report, a look at the issues and events of importance to our viewing area. Now, here's your host.
Well, welcome today to Public Report. I'm your host, Terry Owens. Do you know anybody that's taking an aspirin a day? Maybe they're taking cholesterol medicine, blood thinners. Well, today we're going to talk about matters of the heart. It may not necessarily be the best things to be doing, but we're going to find out what we should and shouldn't be doing. Of course, before you make any major changes, you should always consult your physician. But we want to give you some good ideas and some thoughts that possibly give you better heart health with Dr. Joel Feeman from New Life Chiropractic.
Awesome.
So glad to have you today.
Thanks for having me. Appreciate it.
You're always such a special guest because you're a fountain of knowledge.
Oh, no. That's good,
I'm
right?
just a fountain. I don't know what's going on here. So we're going to be talking about heart health. And actually, a big problem in America today is problems with the heart, isn't it?
Yeah, absolutely. You know, and just like you said, though, our perspective is going to be that of a different perspective. You know, I'm not a cardiologist, I'm a chiropractor. And so our perspective is not so much on treating a symptom, a sickness or disease, but trying to establish the underlying cause in order to try to prevent disease. On a previous show, I was talking about Einstein's quote where he said, you know, intellect solve problems, geniuses prevent them. Right. So if you and your family could learn what it takes and be empowered with such truth and knowledge that you could prevent these crises from ever happening, that would be an amazing victory, an amazing blessing. Because what we find so many times nowadays with heart disease, it's affecting, like I think they say, 1 out of every 2 people who die from a disease is going to die from heart disease. I've heard numbers of saying somewhere in the upwards of 2,200 people per day in America are having something like either a heart attack or a stroke or some type of a complication regarding the heart. So when you look at what's happening in general in our society, there is a big problem that is occurring to where we are taking more blood pressure medications than ever before. We're taking more cholesterol-lowering drugs than ever before. We're taking more blood thinners, aspirin a day, Coumadin, things of that nature than ever before. But when you look at heart disease, cancer, diabetes, you know, over the last 20 or 30 years, has it decreased at all?
No, it's been increasing.
It's been increasing. So there's got to be a point in time to where we sit down and we start to say, okay, if health is what I choose, if this is what I desire for me and my family and everybody that I know and love, if this is what I want, then if I do what everybody else is doing, can I get that result of life and health? And again, Einstein said, in definition of insanity is what? Doing the same thing over and over, but expecting a different result. If you desire to be healthy, you have to have that foundation of what health is and how can you maximize your God-given health and healing potential so you can position yourself in such a way that you can avoid the crisis that so many people unfortunately end up in.
Well, let me just ask you this right out of the box.
Absolutely.
If cancer and high blood pressure and heart trouble seem sometimes to come naturally with aging, should we just accept that?
Absolutely not. Okay, here's the thing. In society, as we mentioned, you know, you see in our office, for example, there's always kids and infants and babies, people of all ages. It's because, first off, we recognize that, number one, if it hasn't produced better health in the last 30 years, if we don't change something, it's not going to produce it in the next 30 years either.
Right.
Okay? So this idea that so many people fall victim of is they think that, well, it's a normal thing. I can expect, like so many other people, to have a heart attack once I get in my 40s or 50s or 60s. I can expect to be taking a blood thinner once I turn 42 years old, and it's a prevention type of what they call preventative medicine, or taking cholesterol drugs and whatnot, because as I get older, that's what I have to look forward to. And I'm here to tell you, Terry, that's not the truth at all. There's a difference between normal and common. Yes, I can tell you confidently that it is common to have these issues in our society, but that does not mean that you're created with this inability to heal and be well. Because if it was a normal thing, then there are still people out there who are 50, 60, 70, 80, 90, even 100 who have normal to low blood pressure, have fine cholesterol. You see what I'm saying?
Right.
I just even had a doctor yesterday I was listening to, and he was just talking about that very thing, how society, unfortunately, has taken this turn to where we think that it's something that we should accept. We think that it's genetic, but the reality is it's not.
Right. Which I was going to ask you, what happens if runs in your family? What do you do then?
Yeah, well, this is what they're finding, okay? And I'm just telling you what the research that I've seen has shown. They're saying that the correlation is about 2 to 4%. okay, in genetics. And so a lot of times people will respond and say, well, my grandmother, even my grandfather, okay, my grandfather who passed, they said, well, your brother had a heart disease, your dad had a heart attack. So they said, George, you know what, you can just basically accept that's the way it's going to be. Take the blood thinners, take the blood pressure medications. This is who you are, and this is the best you can look forward to. You know, and we have that option then to recognize, is that truth or is that a lie? Okay, and the only truth, as far as I'm concerned, is the truth of what God says. You know what I mean, in His Word. Other than that, it may be a fact, and the fact might be that there's a lot of people in our society that have these problems. But truth is truth, and lie is lie. You see what I'm saying? So what happens is when you look at the whole issue of family, what they find more than anything else is the lifestyle choices and the common things that families are doing. So if you, for example, do the same thing that dad did or mom did or grandparents did, sit at the same table sucking down, you know, the sodas and the macaroni and cheese and corn dogs and eating just a bunch of junk and going to the doctors, having the same drugs given to you, living the same lifestyle, whether it's, you know, not exercise or whatever. You get the idea. You know, you can take a little baby that's adopted from a different nation, different country, speaking a different language if they lived over there, but you bring them over here and you raise them in your household, and what they're showing is that it's not so much anything more than the environment they live in. Yes, there are tendencies, but like I said, it's less than what people really think. And you have the potential, even if there's a family member who does have heart disease or diabetes or cancer, you have the potential, because genetics can get either better or they can over time get worse. You have the potential to choose life, so that way you too, through the epigenetic studies, have the chance to change not only for yourself, but for your offspring as well.
Well, I've come to the conclusion there's a new disease out there. You know, you got ADD, ADHD. I found out some people have DUH. Duh. You know, we try to blame it on everybody else, but sometimes we got to take responsibility for our own actions.
It's easier to point fingers. It really is. And that's why even with a lot of our health workshops that we do and with new practice members, a couple of approaches that I take is I'll have that patient first recognize what they want, where they want to be. Because if you were to, let's say, for example, average patient walks in the office and you ask them a question on a scale of 1 to 10, with 10 being perfect health, where do you desire to be? If 10 is exactly the way God created you with the potential to have, if that's what 10 is, then where do you want to be? And most of them, which surprised to me, said about an 8, about a 7, about a 6. And it's all relative to where they think they are, which I would then ask the next question, well, if that's the case, where do you see your health at right now? Well, I'm taking 12, 15, 20, 30 different medications, and so therefore, if that's the case, that 5 is looking pretty good compared to the 1 that they feel or what they think that their health is at. You see what I'm saying? So when you look at that, the bigger picture, it has to be, where do you desire to be, and are we able to go that direction? You see what I'm saying?
Right.
And so, yeah, I mean, the whole genetic thing, you know, to me, and what most people do is not necessarily the approach that I feel is the best, just to con people, you know, to con and say, okay, it's easier to do that. So when I tell these patients, hey, listen, your health is your responsibility. It's not mine. You see what I mean? Because people a lot of times want to blame their health on a doctor. You know what I mean? And you know, they want to take less responsibility for themselves and put it on somebody else. That's one approach. It's not the right approach. You see what I mean? We're called to be stewards of great life and health. It's not our body. What's 1 Corinthians 6:19 and 20 say?
It says we're the temple of the Holy Spirit.
That's right.
Yeah. Now, do you think sometimes we get so used to feeling bad that we don't know what it really means to feel good?
Yeah. It's like a dimmer switch. Sometimes it's like it's being turned down so slowly over time in life. I mean, sometimes you have those issues that it's all of a sudden. You know what I mean? But most people, they don't even realize. I was just telling a patient yesterday, you know, when they say, well, my health is, you know, it's right here. I said, well, that could be. But most people, their response is, I didn't know how bad I was until I got back over here. You know what I mean?
Right.
And now I realize, now that I've experienced true life and health again, you see what I mean? Now they have that realization that their body was degenerating for years. You see what I'm saying?
Well, let's talk about the big 3 here: blood pressure, heart disease, and cholesterol. I'm so excited. Now, we're not doing an infomercial for Dr. Joel Freeman, but I've been coming, I haven't been there a year yet. Coming up in April will be, I think, my year anniversary with you. And when I came to you, I was taking 5 blood pressure pills a day. Just to try to keep me in control. I went into the hospital not taking any blood pressure medicine, leaving with 5 different pills to control my blood pressure. So far, they've cut me back to, I'm just taking 3 pills a day instead of the 5. And 2 of them that they've cut out are high-powered ones.
Yeah.
So I'm excited about that. So does chiropractic care kind of help in that matter?
Yeah, and I'll answer that in a couple different ways here. Absolutely, number 1, yes. Okay, but here's the thing. when you look at, again, this concept, is trying to, again, stir up the thinking, so then that way, whether you feel that, or any person who's watching is feeling, well, that's the method for me, you have to look and see, because otherwise, if we just base everything off ignorance and not knowing, then, when you look at it, if any average patient is told that they have high blood pressure, right away their doctor's going to give them what? Blood pressure medication.
Yeah.
And so right away, what happens typically is they're going to go into to the office then a couple months later, maybe 3 weeks or 3 months later, and they're going to look at the blood pressure, and many times it's going to show that maybe it has gone down a little bit, okay? But then here's the question, though, that I have initially with people. Who's to say that your blood pressure wasn't high for a reason? You see? Right. Because most people are given a medication, and how long are they expected to take that medication?
The rest of their life, unfortunately.
The rest of their life. So if you look at it from a physiological response, if the innate wisdom that God has breathed into your body, that created you from 2 cells to live in the life that you have at this point, digesting all the food, and exercise and heart rate going up and down, oxygen, CO2, all the tens of thousands of things that happen every moment of your life. If this life that God put within you has one purpose, to always produce life, to connect the brain cell to the tissue cell, then is it possible then that the blood pressure is up because at this moment in your life, even though it's not the best of situations, that your body had to adapt at that moment for the sake of living? You see what I'm saying?
Very good question. Matter of fact, I almost think that they're lowering the standards to try to increase the more sales of the medication. Because I actually found a dirty little secret the other day in looking at some health insurance. Mm-hmm. They wanted to know, is your blood pressure at least 150/90? As the standard. Now, if you go into the doctor's office with 150/90, they're going to be putting you on medication right away. Yeah. But in the health insurance standards, they said that's okay. Yeah. So are we lowering the standard to try to sell more medicine? Well,
a lot of times you have to recognize, and I don't want to get too far into the whole drug industry thing. I think it's
a whole new show by itself.
It's a whole new show, yeah. And but the end result, in my perspective, is life and health, life and health, life and health. So if I look at, for example, a person who's given 1 medication, then next thing you know, they're taking 2 or 3 or then up to 5, okay? The question has to be is, Doc, do you ever believe that my body can be healthy in such a way that I don't need this stuff anymore? And 9 out of 10 people, 9 out of 10 doctors, what are they going to say?
You got to take it.
You're going to have to take it for the rest of your life. You see what I mean? So the question I always go back to then is that true healing?
No.
See what I mean? Because healing is an action or a process that's taking place, so you can go towards that place of optimal life and health. Disease is the process continually getting worse, and that's what we find that most people don't realize, is that if they change nothing, because oftentimes what will happen if people are honest with themselves is if they go to their doctor, okay, and their doctor is just there doing their job, okay? It's not that they're bad people, nothing like that, and we're not saying that.
Right.
But if they go to their doctor and the doctor says you have blood pressure, there's something in most people inside that says, oh crap, you know what I mean? Maybe I need to do something different with my life so that I may live. I mean, I'm always surprised when people come into the office and they reckon, I mean, think about a wife who her whole security is based off of the fact of if their husband doesn't get that blood pressure medication or that cholesterol lowering drug or that Coumadin or whatever else, then they don't have a husband anymore. Imagine, you know what I mean, how it must feel for a grandkid when they walk into the grandma's kitchen or grandpa's kitchen and they see a whole shelf full of different medications, to know that if they don't get those drugs according to the medical standards, they will die. You know what I'm saying?
Right.
And so what happens is oftentimes we don't recognize that we put so much faith in something that in the end we have to take for the rest of our lives. And if you stop taking those drugs at any point for 3 or 4 days, what happens to that blood pressure?
Just right back up.
So is it healing or is it counterfeit to healing?
It's a counterfeit to healing. I don't give any credence to my pills that we're taking that's lowering my blood pressure.
That's right.
I give two call-outs to one to God for the healing power that's within Him.
That's right.
Number 2, I believe it's because of the direct chiropractic care I'm receiving.
Yeah. You see, and really, we always tell people in the office, there's several, in our office we have different signs, and one of the signs that we have right in front of the adjustment base is it says that the power that made your body does what? Heals your body.
That's right.
Another sign says healing is on God's time.
That's right.
Okay? And then there's another one that says doctor moves the bone, God does the healing. See, the thing is this. You have the potential within you to truly heal and be well. then we have to recognize, am I a sower of life and health? Galatians 6:7 says that as a man soweth, he too shall reap. Am I sowing life, health, and vitality in the way I live? Or is it something, unfortunately, that I'm just living life, I'm not changing anything, but I expect this medication to actually change my life for me? So whether it be a vaccination, a high blood pressure medication, or whatever it might be, there's something that has to happen inside of us that says, I want to change. And here's the thing, there's something that we live by in the principle of chiropractic world, and there's principles that are the foundation of who we are and what we believe. And unfortunately, not all chiropractors know these or are practiced by these principles. But they're all principles that say this is who we are and this is why we do it. And one of those principles has to do with the law of adaptation in time. See, here's the thing. As I mentioned just a moment ago when we were talking about your body's blood pressure going up for a reason, again, it may not be the best of situations. But the law of adaptation in time states that if I want this muscle to become bigger and stronger, what do I have to do?
You got to exercise.
I have to exercise. I have to create a need for my body to adapt in such a way that it would become stronger. You see what I'm saying? Right. There has to be a resistance that the body can build off of. You see what I mean? The same thing with the immune system. If you take and you start off a child that has taken antibiotics and vaccinations, whatever else, it's not that their body wasn't capable of killing off those bacteria, right?
Right.
But if the antibiotics may kill off those bacteria, but their bodies still have that same potential within. And when you allow that, just like chickenpox, when you allow the body to take that natural process, you have a lifelong immunity. You're actually becoming stronger, not weaker. Just like Scripture, it says, when you go through the trials and tribulations of life, what effect does that have on a man's character?
It builds it.
The law of adaptation in time. You see what I mean? So if you take the same law and you start to say, is my brain ever getting, and I'm just challenging thinking here,
right,
okay?
right.
I want you to think here a little bit with me, but if I'm wearing glasses, like a lot of people do.
I got new specs.
And they look good. But here's the thing. Is my body getting the message that my eyes need to heal? Or is it getting the message that you can already see me, you can read, you know what I mean?
Right.
Your brain's not getting the message saying that healing isn't even necessary at this point. If I look at the blood, the blood levels, and I see the insulin or the blood sugar levels, are in a normal range, is my brain ever getting the message to heal what needs healed in order for my body to be at the level of health? You see what I'm saying?
Right.
And the same thing with the heart. If the heart is truly a muscle, right, and I'm thinning the blood, is that increasing or decreasing the resistance to that muscle tissue?
If you're thinning the blood, it's going to decrease the resistance.
It's going to decrease. Yeah. So is that then, based off of exercise physiology studies, is that going to strengthen and keep your heart strong, or is that going to cause the heart over time to weaken? I'm just asking a question.
Well, that's a good thought.
You see what I'm saying? But
right.
These are the questions that we need to ask and not just say, we'll take your blood pressure down. Because if you jumped out at me and scared me, right, and my body went into a physiological state, which is a fight or flight mechanism,
right.
At that moment, my body responded in an instant for the sake of survival, right? So if your body's always trying to adapt for the sake of survival, and your blood pressure, again, is higher, could it be that that's because your body needs that at that moment? Maybe because you're dehydrated. Maybe because you're eating unhealthier foods, or there needs to be some increase in exercise. Maybe there's an imbalance of your nervous system, like what you were talking about with chiropractic care.
Right.
You have your autonomic nervous system, which are your healing nerves. They either speed things up, the tendency, or to slow things down. If they're in balance, your blood pressure is going to be perfect. But when your nervous system has interference due to the stresses of life, something in chiropractic we call subluxation, irritated nerves, then all of a sudden, if there's that imbalance where you're getting too much of one signal and not enough, it's just like if you turn on too much hot water, too much cold water at the sink, you can either get too cold or in hypothermia, you can get burned. Right. But when you put them on equal, things can, it's a good thing. You see what I mean? Right. So a lot of times what we'll find is that the nerve system is completely imbalanced. And so what the studies have shown is that when they look at chiropractic adjustments, particularly of the C1, the top bone of the neck, when they get that adjusted, they say that it decreases, here's the cool thing, that it decreases the blood pressure as much as 2 medications would.
Wow.
Now, how many meds did you get off of so far?
2.
2. So imagine this. Chiropractic here, let's just say, because, not that it's chiropractic, but it's because of a balanced, fully functioning nervous system that can express life at closer to 100%. If your nervous system becomes balanced, and that can lower it as much as 14 points or 17 points, to take off 2 medications, then what starts to happen when you start to drink more water?
it's going to even lower it more because your blood will be thinner.
Because the blood is going to be thinner. And not only that, but the muscle, the tissues of the body, just like a dehydrated piece of fruit or vegetable, they shrivel up and they stiffen. You see what I mean?
Yeah.
So the tissue is going to have different characteristics there. So now we start to eat healthy, we start to maybe walk or exercise in some way, we start chiropractic here. All of a sudden you see the TV will tell us a lot of times that if diet and exercise are not enough, yeah, those things are great and they're definitely needed for health. But there's more than just diet and exercise.
Right.
You see what I'm saying?
Absolutely.
So with blood pressure, it's not uncommon at all for people to come in and tell us that they're getting off a bunch of different medications, even if they've been on this stuff for years and years and years, because we teach them as much as we can how to be a sower of life and health. And then we care for the nervous system, and we empower them with the means that they can start to take care of themselves. So if health is what they truly want, now they have a plan to get there.
Well, let's they're throwing blood pressure medicine at us. They're also throwing cholesterol lowering medicine at us. My doctor, I won't name him, but he even said, I won't take it because I've been enough in your classes, and my blood and my cholesterol levels are in good range. So why should I take medicine that I don't need? He said people take them as supplements. That's what he's trying to use to get me to take them.
Yeah.
I thought that's a dangerous thought.
Yeah.
Do we need a lot of that statin stuff that's going into us?
Well, I'll tell you, one of the things that when I first started in practice, the first year, although I knew the principle of life and health and chiropractic, at that time, believe it or not, I didn't do the newsletters, I didn't teach the classes, I didn't do that stuff because I was afraid to talk in front of people, believe it or not. You know what I mean? And so what happened is that the first year in practice, I had 3 patients who had died. And they all died because of a side effect to a drug reaction. One of them, her name was Marilyn, who died from liver complications and failure because of the statins. You see?
Wow.
And they know that's what's going to happen because the cholesterol, the majority of cholesterol in your body is produced. I mean, your brain is like 60, 70% cholesterol, they say. Okay, it's produced most of it by the liver, and it has a purpose that way God created you. You see, so when they're taking and giving you blood pressure or cholesterol lowering drugs, what they're trying to do is to back up a step. They're trying to decrease the bad cholesterol, which is the LDL, while maintaining good cholesterol, which is the ADL, okay? But let's not think of it as good or bad at this point, okay? Let's think of it as these are the cholesterols that God designed for your body to produce. When your body's healthy, it's going to be in a perfect, healthy range.
Right.
So this is what they find. And again, I'm just trying to stimulate your thought here from a different perspective. It's not just that the cholesterol is high, but the question would be, why is the cholesterol high? What's the purpose of the bad cholesterol, the LDL? You see what I'm saying?
Correct.
So if they say the purpose of that, if you look at the body, is it's like patching up a road after winter. You see what I'm saying?
Yes.
It's like going through, and it's for healing and repair to patch things up. But the problem is that is there a stress in our lives? You know what I mean? Are there stresses chemically, spiritually, emotionally, mentally, you know what I mean, physically, stresses in our lives that's creating a need for the body to continue to try to patch things up? So what they do is they say from a drug perspective, from what I understand of it, they say, well, let's just stop the production so that we get into the liver through the chemicals and we alter it in such a way that now the body is not going to produce the bad cholesterol anymore, which means that if the body seriously has a need to mend and repair things by using that bad cholesterol, if you will,
It won't be available.
it's not going to be available to do it. So now we end up, and it's like, well, we've solved the problem, cholesterol is down. But I just heard a doctor yesterday, and he was giving a lecture, and he was saying that 60% of the people who have a heart attack and die have normal to low cholesterol.
Wow.
So it's like, is it really even, you see, but you can create any sickness or disease and any medication for that, but it doesn't necessarily mean that that's what's going to help you to live the longest, healthiest, most productive life possible. If it's an emergency situation or crisis, do what you have to do until you figure out what you need to do to regain that level of health and healing. It's just like one of my colleagues, Dr. Chestnut, says. He said, if you're a fireman and you show up for an inspection with an axe and a water hose, you don't have the right tools for that. You need a clipboard and a pen at that moment. You see what I mean?
Right.
But if you show up to a fire with an axe and a water hose, praise God, you are prepared to possibly save a life. You see what I mean?
Yeah.
If the day after a fire and there's nothing but ruin, and you show up with that axe and a water hose again, once again, you don't have the right tools to rebuild. You see what I'm saying?
Yes.
So what we're doing a lot of times is we're using, in other words, that analogy, we're using the same tools for both preventative health care as well as regaining health once we've lost it, and not just for crisis like it's really designed and intended to. Does that make sense?
That makes a lot of sense. Boy, I tell you what you're saying today should be an eye-opener to a lot of us. Why, if we're going out and killing ourselves by eating a lot of bad stuff, and we talked about that on another show about our diet and stuff, then that's one problem. But if our body's naturally producing it, it's for a reason.
That's right.
And we don't want to destroy what our body
and so
needs.
trying to establish what is the innate wisdom of your body need to complete that cycle of healing. ING is that process. You know what I mean? Yeah. And once you establish what your body needs, to say, I have high blood pressure and that's a normal, healthy, healing response, and then do nothing, not wise. It is not wise. You see what I mean? But to say, I have high blood pressure, unfortunately, right now, which means that my body is adapting in a way for the sake of survival, I need to find out now where I am weak so I can become strong. You see what I'm saying? There's a difference between doing action versus no action. You know what I mean? And so we got to be people of action.
Absolutely. So, our diet has a lot to do with it. Our follow-up care, exercise, going for chiropractic care.
Absolutely.
Even if you don't have a hurt back, let's talk about, we only got 3 minutes left, and we don't get a chance to talk a lot about chiropractic care. And it has a lot to do with how our body's functioning, as you shared early. You don't have to be hurting in order to go see a chiropractor, do you?
No, it's because, here's the whole thing, and I'll try to keep it very simple for the sake of time. 3 types of nerves. Nerves that make you feel, heal, and move. The feeling nerves only represent, they're called sensory nerves, 6% of the nerves. 94% of the nerves have no ability to ever give you a message of how you feel. So like what you said at the beginning of the show here, you were talking about how you've been coming in for quite some time now, several months, nearly a year. So why is it that, like in our office, we have that sign that says, this is a lifetime family practice. We see you from your first breath to your last, or as long as you desire to be healthy. It's not that we twist your arm to come into the office.
Right.
People want my help, I'll do the best I can. If they don't, God bless you as you go. I'm okay with that. You see what I mean? But the point is that when you start to understand and value life and health and value the seeds that are sown for the sake of sustaining that life, or gaining then sustaining, then it's one of those things that people choose to be healthy for a reason. You see what I'm saying?
Right.
Because they see it in advance that I want this. I want to meet my grandkids. You see what I mean? So it's trying to do everything we can, recognizing that the stresses of life interfere with your nervous system. It's your nervous system that controls everything that's within your body. So if chiropractic is the only successful means of keeping your nervous system balanced and healthy, then we got to make sure that we detect interferences before it gets too late and people start to have health-related issues because of irritated nerves, subluxation, and problem.
I know that was part of my driving force wanting to come see you. Wasn't because I was hurting everywhere, it's because I wanted to be in better health. Yeah. And if you could loosen up those areas, I'm still waiting for you to find that sweet spot to grow hair.
Right.
We haven't found that one yet. Which sea level is that?
That's right.
So, wow, great information today. Folks, we appreciate you tuning in, and I hope that you've gained a lot of great information, because we're talking about matters of the heart. Your heart does matter, and the most important part of your heart is whether Christ lives within. And we hope that you have Jesus Christ living. That's the first place to begin a healthy heart, is with Jesus Christ. But then it's up to us to take care of those things the rest of our life. You just can't do a one-time workout and then expect you to be healthy the rest of your life. So thank you, Dr. Joel, for coming and being with us today.
My pleasure.
Always great information. And if somebody ever wants to just stop in and pick up a newsletter, can they just do that?
Absolutely. They can go to our website, www.newlifechiro.net, find out information more about our office. We have blogs, videos, newsletters, and whatnot.
Okay, well, thank you. Thank you for watching Public Report. We hope you've enjoyed it today. God bless you. We'll see you later.
This has been Public Report. Public Report discusses the issues of interest and importance to our viewing area. Please remember that the views expressed by our guests are their own and do not necessarily represent the views of TCT or the station.